you've got a grant. Congratulations. That buys you a little bit of time to start thinking about how to get off of grant money. Now, why would you want to get off grant money in the first place? The reason is that you want your impact to not only last for years, but perhaps decades and perhaps lifetimes. And you may not be around to be fundraising 3 lifetimes away from now. So how can we start thinking today about getting you off of grant money so that tomorrow your system will run on its own? Well, there are 4 ways potentially to think about this, borrowed from Martin Fisher and Kevin Starr. The first exit strategy from philanthropy might be to solve the problem completely, and that works well if you're dealing with a challenge that can be solved completely. The world has done this well with the eradication of smallpox or with the elimination of malaria from the United States. There's also examples of behavior changes that are very difficult to roll back. So, for example, open defecation might be popular in some parts of the world, but are totally social taboos in others. Or, in the case of maternal and newborn health, there are communities where giving birth at home is similarly just not done. These types of solutions, though, can be really challenging as well. In the case of disease eradication, they take tons of money and huge timelines. You've got to have very patient investors who are really with you for the long haul. In the case of behavior change, rollback can be a constant threat if it turns out that the community isn't necessarily interested in that particular type of behavior change. So if your problem doesn't lend itself well to a complete eradication type of solution, what else might there be? A second exit strategy from philanthropy might be to find an intrinsic funding source. So you might be able to have some sort of endowment or other goose that lays golden eggs indefinitely that can support your work in perpetuity. Great if you got it, but a pretty rare find. Another opportunity might be able to use local funding, which is able to recirculate. So there are examples of this in merry-go-round finance programs. In Latin America, they're often called tandas, or in Kenya, called chamas, where a group of women will get together and they will all put money into a central kitty, and then every week, some different person gets to take the money out. Well, the system works really well so long as every single person plays by the rules every single week. You may have a system that can actually sustain itself that way, but that's also a fairly delicate approach. One to consider, but not necessarily the perfect match for everyone. A third exit strategy from philanthropy would be to rely on taxation. This is something that folks in public health often default to, but it's not as easy as it sounds. Having the Ministry of Health pay for something or the Ministry of Finance pay for something is actually incredibly difficult. You need to have a scenario where you understand how those government bodies work and the connections to get the right types of introductions and ultimately gather the funding. There are examples where this does turn out to work well, but it's kind of few and far between. When we think about pharmacies in public centers stocking critical drugs for maternal and newborn health or any other affliction, they're often plagued by stockouts or by pilfering or any other challenge that may prevent the product from ultimately finding its way to the ultimate beneficiary. Support through taxation may also be subject to the whims or interests of the voting population or of the politicians at hand. This method may also be one of relatively low efficiency and somewhat unreliable in the long term. But in cases where there is no other solution, this is the way you've got to go. The fourth exit strategy from philanthropy would be to figure out a way of creating a profitable business. Easier said than done, but if you have the opportunity, it's certainly the way to go. There are a couple of examples of this working well in terms of private pharmacies that might be supplying malaria drugs to folks who otherwise would not have access, or private practitioners who will offer high-quality care to those who can pay. Now, it may not meet the needs of the lowest rungs on the poverty ladder, but for the next couple of steps up, it might be the right solution. A profitable private sector supply chain only works if everybody in the chain is making money at every single step. So as that maternal health drug finds its way from the manufacturer, through the distributor, to the retailer, everybody's making a markup. And by the time that it gets to mom has a willingness to pay that is in fact a little bit higher than all of those costs combined. See if your particular product or service fits this model, and if it does, it's definitely the way to go. When people are making money from a particular intervention, it will scale faster and further than any of the other channels, and perhaps any of them combined. One thing that applies to all 4 of the exit strategies has to do with timeline. Things take a very long time, and grant funding is really critical for bridging that gap. I'll give an example of something that's used to save the lives of preterm babies. It's an antenatal steroid, an injection given to mothers in preterm labor. One shot in the arm can halve the risk that a baby would die from respiratory distress syndrome. Now, we've known about this intervention since 1972, but it wasn't until 20 years later that it became part of the American caregiver's standard routine. Well, 20 years since then, in today's world, it's still practiced in less than 5 to 10% of hospitals around the developing world. So we've got a 40-year lag between innovation and introduction. In thinking about your exit strategy from philanthropy, you've also got to be thinking about that kind of timeline. Now, 40 years is way too long for anybody to want to have their timeline last, but it actually may take that long in some cases. So as you think about that transition from philanthropy to any one of your 4 exit strategies, what are the steps along the way, or those transition points, where you can start moving from philanthropy to perhaps a mix of a little bit of subsidy from taxation with a little bit of private sector, or start thinking about how you take these primary colors to paint the picture that you want to see in the end. So, my question to you, what's your exit strategy?